I'm Dr. Stephanie Brode, and we are back with another episode of the Addiction Education Series presented by the Cardinal Crew. Today, we are going to talk about portal hypertension. So what exactly is portal hypertension? Well, I'm going to use this diagram above to help me explain. So the liver has a blood flow system that has this very large blood vessel or vein that runs directly through the center. That is called the portal vein. By the way, I do not own these images. I got them from Google, and this is the source for where they come from. Anyways, so the portal vein here carries blood from the digestive tract and back up into the heart. So when there is increased pressure within this vein here, you can have portal vein hypertension. And hypertension is a term that just means high blood pressure. So what causes portal hypertension? The most common cause is liver cirrhosis. The liver tissue becomes scarred and nodular because of the chronic liver disease like hepatitis or alcoholism, and that change in the landscape of the liver puts the pressure on that portal vein and causes portal vein hypertension. A lot of times people who have portal vein hypertension do not know that they have it. Usually they determine that they have it once they get some of the complications from it. Some of those physical signs that they may see are jaundice, which is yellowing of the skin or yellowing of the whites of the eyes, easy bruising, abdominal swelling when the abdomen fills with fluid, and occasionally some GI bleeding. As you could imagine, this isn't a good situation. There are a lot of complications that arise because of portal hypertension. One of the things that can happen is something called esophageal varices, where there are dilated veins within the esophagus, occasionally the stomach, sometimes the rectum. They can rupture and cause severe bleeding. It can cause or contribute to ascites, which is the accumulation of fluid in the abdominal cavity because of the increased pressure. It can lead to hepatic encephalopathy, which we've talked about before. Basically, there's a buildup of toxins in the bloodstream because the liver isn't functioning appropriately. It can lead to splenomegaly or an enlarged spleen because there is increased blood flow and congestion, and it can lead to portosystemic shunts. So essentially, this is the development of additional blood vessels that are made specifically to bypass the liver, but ultimately it leads to even more complications. What do we do about it? Well, we need to target the underlying conditions. So what caused that liver disease? So for the patient population that we are typically talking about it would be targeting their alcohol use to limit and lower that. We want to prevent complications from having hypertension in the portal system. So occasionally we can use medications like beta blockers to help decrease that pressure and therefore decrease the risk of the complications like esophageal varices from bleeding. In very severe cases, you can consider liver transplantation. That's another topic in and of itself, so we'll save that for another day.